Good morning, students. Today, here I am with a lecture on congestive heart failure. Earlier, I have delivered a lecture on hypertension. So, let us see what is congestive heart failure, its causes, management. So, coming to the definition of the congestive heart failure, it can be defined as a clinical syndrome, which is generally a complex one, but not exclusively. It can be characterized by underlying structural abnormality or cardiac dysfunction that impairs the ability of the left ventricle generally to fill with or eject the blood, particularly during the physical activity. Mainly, this CHF is seen when the person has or performs more physical activity, and the main symptoms of the CHF is dyspnea and fatigue. Next, before going to the topic, let us discuss that how the blood flows into the heart and the body. Here you can see that the blue line, the blue colored indicates that it is the impure blood, and the red color indicates is the pure blood. The superior vena cava, it collects the impure blood from the upper part of the body. The inferior vena cava, it collects the blood from the lower part of the body. The pulmonary artery, and you can see two sides are there. One supplies the blood to the right lungs and one to the left lung. The pulmonary veins, they carry the blood from the right lungs, and this pulmonary vein, they carry the blood from the left lung. So mainly the left ventricle is responsible for pumping the blood to the different parts of the body. The aorta pumps the blood to the lower body. Okay. Now coming to the symptoms of the CHF or the congestive heart failure. First important symptom is the shortness of the breath. Now, this shortness of the breath can occur at the rest or due to the activity or the exertion, or if a person is lying flat, he can also feel the shortness of breath. Or if the person is awaking, like he is in a deep sleep and he immediately awakes and he feels that he is having the shortness of breath, which is called as a nocturnal dyspnea. Or if the person has a decreased amount of the fluid in the body, the fluid accumulates in the lungs, so the lungs cannot pump the blood to the heart, or it cannot supply the blood to the heart, so the heart cannot pump the blood to the different organ systems. The second symptom of congestive heart failure is the chest pain or the angina. Third symptom is the right heart failure, the left heart failure, or the both. In case when both of the chambers, you can say the both of the sides of the heart, they fail. Generally, this occurs when the fluid in the tissue and the organs, they that deliver the blood to the right heart, they get leaked, or the pressure in the capillaries, they get increased, and generally the fluid is accumulated in the lowest part of the body. Or due to the gravity, the fluid accumulates in the feet or the ankles. We have the swollen legs. Or if a person is having hepatomegaly or the swelling of the liver, or generally the fluid accumulates within the abdominal cavity, or depending on another or other clinical situations where the person has different kind of conditions to lead to the heart failure. Now coming to the main causes, or what are the reasons that a person gets this congestive heart failure. The first one is the coronary artery disease, where the arteries, they get diseased, and they are unable to supply the blood to the remaining part of the bodies. Hypertension, it is the important cause for the congestive heart failure. If there is a hypertension, then elevated blood pressure, so ultimately this will lead to the congestive heart failure. If a person is on the alcohol abuse, like he is taking a long standing alcohol abuse, other disorders of the systems, or you can say the heart valves, they don't properly work. And the last one, you can say it's a idiopathic cause, where we don't interpret that what's the reason for the particular disorder. Now coming to the secondary causes, some of the causes like viral infection of the stiffening of the heart muscles. In some viral infections, the heart muscles, it gets stiffened or hardened so that they cannot pump the blood to the remaining body parts. If you have the hypo or the hyperthyroidisms, that is considered as a thyroid disorders, Next is the heart rhythm abnormalities. Then you have bradycardia and tachycardia, or the rhythmic movement of the heart is not there. Then you can also lead to the congestive heart. Now, as per the New York Heart Association, this congestive heart failure can be classified into four classes, like NYHA1, where there is no symptoms or the person is asymptomatic. Sometimes the person feels that he is having shortness of breath during the moderate or intense physical activity. Second one is reduced physical capacity for moderate intensity physical activity, mainly breathlessness when you're climbing the stairs or when you're doing some exercises. The third one is NHYA3, where several reduced physical capacity for the low intensity physical activity, like breathlessness except when at rest, like when you're walking or eating or sleeping or talking, you get that breathlessness. And the last one is NHYA, symptomatic at rest. That means every time the person has the symptom of breathlessness or angina. Now, how can I detect it? The easiest way of detecting a congestive heart failure is the electrocardiogram, or we can say the ECG, which assess the heart rate, the rhythm, the PQRST curves, and you can determine that a person is having a congestive heart failure or not. Second is the chest X-ray. You can look into the size of the heart in presence or absence of any fluid in the lungs, a deposition of the fluid in the lungs. Third is the doctor can suggest you for the complete blood count, where you can get the total picture of the blood, like RBC, WBCs, electrolytes, glucose, creatinine. Creatinine is mainly done to assess the kidney function. Yeah, the doctor can also assess about the B type natriuretic peptide. Generally, it is done for the patients who have the shortness of breath from the congestive heart failure, and it is a type of a chemical which is secreted from the heart ventricles, and it is released when your heart muscles they get overloaded. So the amount of BNP can determine that whether your ventricles are overloaded or not. Next is echocardiography or the ultrasound testing. This is also can be done to assess the anatomy of the function of the heart, that whether the heart valves are functioning properly or the muscles are functioning properly. Or next, coming to the management of the CHF, there are some management goals like uh, before getting the disease, how you can prevent the occurrence of the disease. So we have to prevent the CHF in the people at the risk. Like people at the risk means those who are obese or those who are having any other comorbidity like diabetes, renal dysfunction. For them, we have to prevent the CHF. We have to detect the asymptomatic left ventricle dysfunction. We have to relieve the symptoms and improve the quality of life, like counseling the patients or counseling the people. We have to slow disease progress and prolong survival, like how the CHF will be progressed slowly. If it is there, it should progress slowly, and the person can long for a, survive for a prolonged period of time. We have to improve the physical activity tolerance, like increasing the cardiac volume or you can say lungs capacity, and reducing the hospital admissions. So these are the management goals. Now, coming, how do you educate the people for the self management? It's really a part of the patient counseling. So first is we have to teach the people to monitor the CHF or control their fluid balance. We have to suggest them to limit 2 grams per day of sodium intake, and the fluid intake should be more than 2 liters per day. The caffeine should be reduced to 1 to 2 drinks per day. The person should be advised to check their weight and maintain the BMI. Any symptoms of dyspnea, edema, or bloating should be taken into consideration. Alcohol intake should be reduced. If the person has the CHF, they should be advised to take the vaccine for the influenza and pneumococcal diseases to prevent the pneumonia. And bed rest should be advised for the persons if they have some clinically unstable conditions or exacerbations. Now, this is a slide which I have kept. You can see clearly we have different treatments of CHF. Here we have some agents, the recommendation and the prescribing notes. We have AC inhibitors, we have loop diuretics, beta blockers, ARAs, spironolactones, eplerenone, digoxin, direct sinus mode inhibition with ivabradine, nitrates, and some fish oils, natural oils, and the iron. So this slide will tell you about that what is the recommendation, which type of people should take it, and in which concentration the person should have this medication. So this was my presentation for the congestive heart failure. If you have any doubt, you can find my email ID in the comment box. You can type any type of comments, and I will be open to answer the questions. Thank you very much.